Good evening, everyone, and thank you for logging in tonight. My name is Michelle Mohammed, and I'm the Marketing Coordinator for Cell Science Systems. Just a few announcements before we get started with Dr. Blum and Catherine Holmes and Eliana Tucker. We ask that everyone type in their audio pin if calling in with a telephone, and this will allow us to unmute you if you have questions at the end. If you do have a question, please type it in the question box in your control panel, and we'll be sure to answer it at the end. We're planning to go on till about 6 o'clock tonight, so if we don't get to your question, we'll be sure to follow up with you at the end. Excuse me, 7 o'clock Eastern Standard Time. This month, ALCAT will be sponsoring and attending several industry trade shows. We were at the Eldred Taylor Seminar in Atlanta, Georgia, the A Forum Fellowship in Chicago, CNDA in Los Angeles, California, and we plan to be at the GOMA, the Georgia Osteopathic Medicine Association, November 3rd through 7th, as well as the ACAM, same dates, November 3rd through 7th, in Las Vegas, Nevada, and the ADA FNC show in Boston, Massachusetts. We've gotten great feedback from our new functional foods and medicinal herb panels. You can order these as an add-on to any existing panel. And if you have questions about those or any other panels, please type it in your chat box and we'll be sure to answer it at the end. If you're on Twitter, please follow us at twitter.com/the-ALCAT Test. We also have a blog where we post some interesting stories that we find. And you can find it at thealcattest.blogspot.com. If anyone attending tonight's webinar would like to discuss co-op marketing opportunities with the ALCAT Test, please contact me at mmohammed@alcat.com. That's MMOHAMED@alcat.com. Without further ado, here's Eliana Tucker, Dr. Blum, and Catherine Holmes.
Good evening, everyone. Excuse me. Good evening, everyone. My name is Eliana Tucker. I am one of the senior account managers here for the sales department. In this evening's presentation, we're going to cover a couple of topics, including what food allergy versus food intolerance, what the details of that are, gut health, food intolerance, and inflammation, and what that relation is to the ALCAT test. We're going to discuss a little bit about CSS, the company, details about the ALCAT test methodology as well. What is the difference between ALCAT and IgG testing for food sensitivities, which is a method you may be familiar with? Which of your patients are candidates for testing? What are the conditions that you can look for to use the ALCAT test as a tool? Also, we will cover the format of the test results, as well as what the shipping and handling instructions are, and drug interactions as well for your use of the test in your practice. At the end, we will do a question and answer section. Like Michelle said, you can type your questions into the chat box on your toolbar there, and we will get to those at the end. So briefly about Cell Science Systems. The company is a privately held U.S.-based biomedical lab, and we have been in business for over 20 years. The RoboCat 2 is the device that we use to perform the ALCAT test, and we are a registered medical device manufacturer. This device has been awarded 3 different patents. And it is also FDA inspected and registered, and the laboratory is CLIA inspected and licensed. We are also ISO certified, and you can find ALCAT all over the world in 20 different countries. We have 22 different labs throughout 6 continents. So the ALCAT test itself is a whole blood test which we perform in vitro. The process includes incubating the blood after exposure with antigens. We have an availability of 320 antigens at the moment. This includes foods, food additives and colorings, molds, environmental chemicals, herbs and functional foods, and our testing is also CE marked for the European Union and also TUV certified and safety monitored. Who's offering the ALCAT test? Throughout the country and throughout the world, a wide array of healthcare providers are offering the test in different manners in their practices, including medical doctors, chiropractors, dietitians, acupuncturists, and we have several tools to assist different types of practices to really incorporate the test as a valuable tool and an asset in the practice. The test results are laid out in a very patient-friendly manner, color-coded. This is something that patients really have to incorporate into their lives. So the simpler it is for them to understand, the better compliance there tends to be. This is the first page sample of the results, and as you can see, there are 4 colors. The green section identifies foods that are not reactive. The yellow identifies an equivocal reaction, which we call a mild intolerance. The orange section is a positive reaction, which on the test results is referred to as a moderate intolerance. And the red identifies a positive reaction. A strong positive reaction, which the test result refers to as a severe intolerance. With each set of test results, the patient receives this wonderful tool. It's about 50 pages, full color, with a lot of additional details that help clarify the test results themselves, detailed explanation of the format of the test results and the rotation diet that's also included with every test panel of 100 or more foods, as well as helpful nutritional information. And pretty much the second half of the entire booklet is a reference section for them with explanations of the different chemicals, of the molds, additives, and colorings. It's a really fantastic tool that helps them understand where they may find certain chemicals or additives and colorings that may not be common to them. As far as test results, the website is equipped to post those within 5 business days after testing. If you are new and you have not received your web access as of yet, this is assigned after your first test arrives in the lab. If you do not have this, contact either your account manager or the customer service department, and they can very easily set this up for you. So you will be able to access your patient's test results in a PDF format, and they're downloadable as well within those 5 business days. The hard copy follows within about 10 business days after testing. And now I'll turn it over to Dr. Jim Blum and Catherine Holmes to discuss the next section of the presentation.
Thank you, Eliana. I'm going to go through the sort of the science and the medicine of the test, talk a little bit about the differences between IgG testing, IgE, and the delayed sensitivity, or the ALCAT test, and talk a little bit about clinical applications. There's much confusion when we talk about the term allergy and food sensitivity. The allergy refers to the IgE pathway, which is the immediate reaction involving the IgE pathway, which is typified by an immediate reaction to foods such as shellfish, peanuts, and the like, and can be detected through skin tests or the RAS test. And that is something that the ALCAT does not pick up on. So oftentimes we get the complaints that my patient has, you say that there's no reaction to peanuts because that's in the acceptable foods, but I know that my patient is very reactive to peanuts, and that The difference is that that patient is responsive to the IgE type reactions, but not in the delayed sensitivity. However, the IgE reaction overrides the ALCAT. So obviously that patient cannot tolerate peanuts in any sort of manner. But I just wanted to make that clear. The delayed intolerance sensitivity is characterized by the innate immunity system. It has a delayed onset of a couple days through to a week. It has a number of etiologies as to why foods are reactive to the delayed sensitivity, which include a genetic component, some exposure component, cross-reactivity, and some other sort of immune characteristics. So it's not just one type of thing. In the IgE, which we'll talk about in a minute, exposure is a major component to the IgE responsiveness. We're going to talk a lot about gut integrity or gut permeability, the leaky gut syndrome, as we get into this. So the ALCAT test has a final common pathway for an immune challenge. So basically you want to think about this as a white blood cellular challenge test. The white cells are isolated from the blood and incubated with food mashes. And so you're basically challenging the white cells to a mash of a various food, so apple or broccoli or beef. And in that process, the white cells are going to react to everything in that apple. And if there's something it doesn't like, we will see it in the ALCAT test. So we're going to basically measure an inflammatory response from the granulocytes and the lymphocytes to something in that food that is reacting negatively to our white cells. In the IgG testing, there is one specific pathway. It's not a live cell test. It's a plasma test in an ELISA format. And the key component to IgE is exposure. So in order to show up positively in an IgG, the individual has to have had that food repeatedly over the previous week, 2 weeks, 3 weeks. And there has to be another piece that the body is trying to rid those reactions from that food. So there's two pieces to that, but the major component to IgG is exposure related, and that's only one of the components that affects the ALCAT test. The ALCAT delayed sensitivity is very useful for identifying factors that instill the inflammatory response. And I'll talk about how that happens through the leaky gut. But the key piece to the ALCAT test is that it sets up an inflammatory cascade which leads to symptoms. And if the individual is unlucky enough to have enough symptoms that we can classify them as a disease state, I talked about it as a patient has joined the club. They have enough symptoms that they're have psoriatic rheumatoid arthritis, or that they have chronic fatigue, or that they have Crohn's disease or something else. That all stems from the inflammatory cascade that begins with this food insensitivity. I mentioned the leaky gut or intestinal permeability. The mechanism by which this all occurs is through the leaky gut. There are normal gaps in the lumen of your intestines, and through the protein zonulin, which is triggered by a number of, we'll talk about what triggers zonulin, but zonulin is a protein that enlarges the gaps in the intestinal lumen, and during that period, undigested food particles are able to pass through the lumen of the gut. On the other side of the lumen are T cells and B cells that attack that undigested food particle, thinking that it's a bacteria or virus or protozoa. And because it's food and not a bacteria, it can't kill it instantly or quickly. So it recruits other immune cells like natural killer cells, mast cells, and so it's setting up this sort of this cascade that leads to the inflammatory response. And I think we have a picture of this coming up. Well, let's sort of discuss this. Here's our picture. So in this picture, the small white worm-like looking particles are the undigested food particles that are coming through the gap at around 10 o'clock on the clock. And the zonulin are depicted by the blue balls that are on the receptors of the cell wall. So as the undigested food particles come through, you can see that there's a cascade involving various immune modulators and cells, and it kicks off this cascade. And I'm not going to go through the entire cascade here, but we have a sort of a pictorial of what's going on. But that's the leaky gut syndrome. Now, it's important to understand that the ALCAT test is very effective when you consider a couple things. One is getting off of the foods that are reactive, so that's a piece of it. Then treating the patient for a leaky gut syndrome. And we sort of recommend the Institute of Functional Medicine's protocol for a leaky gut, which includes L-glutamine, pre and a probiotic, a digestive enzyme, and healthy amounts of omega-3 fatty acids. That protocol is available through your ALCAT folks. The other piece is what's of shutting down zonulin. Zonulin is a protein that has triggers, and the triggers are heavy metals. So one of the first things that I talk about is your patient having mercury amalgams in their mouth that may be old and beginning to leak mercury into the system? Do they have a history of industrial chemical exposure? Do they use a lot of the artificial sweeteners like Splenda and aspartame and some of the older sweeteners? Do they use a lot of cosmetics? And this is a real trick, because unfortunately a lot of women will use the chromophore type cosmetics, and because they're put on the face close to the mucous membranes, they are absorbed readily, and it's been shown that the chromophores from cosmetics are a big trigger for zonulin. So you may want to talk to your patients about that approach and using some of the less intense color cosmetics. Household chemicals, industrial chemicals, heavy metals. So you want to sort of talk to them about an occupational environmental approach to their life and how they can change that to shut down the zonulin. Why do we want to focus on the gut? Is that 70% of Americans and Westerners have gut symptoms or diseases. It's one of the most sensitive organs to an insult and is easily disrupted. So it's the perfect place to get out of whack. And the reason that we talk about the ALCAT and the approaches with the leaky gut and the toxins are that this is what you want to do, is to heal the gut first. And if you follow sort of the new wave of functional medicine, they promote or they teach that healing the gut is one of the most important first steps to treating all kinds of different diseases. Once the gut is fixed and healed to a greater extent, a number of other conditions can be attacked with much ease. So that I've talked to physicians who are dealing with hormonal imbalances, and they go back and forth because different approaches don't seem to be working on a consistent basis. However, once they heal the gut, it's a lot easier to approach it systematically and get the results that you're looking for. So that's one of the reasons that we really go after the gut as the keystone to health in the functional medicine paradigm. A healthy gut is characterized by a good mix of good flora, good immune function, repair, and the ability to be able to detox foods. Good digestive enzymes, an adequate pH, the good intestinal barrier functions, and a truly functioning autonomic function. An unhealthy gut, poor diet, medications, infections, the toxins I talked about, inadequate enzyme production, a dysfunctional flora, impaired gut permeability, and an altered autonomic function. This is a pictorial of one of the cells, one of the white cells, a granulocyte, throwing off its packets of bullets in order to attack a bacteria. There's both a pictorial up on top and on the bottom a microscopy approach to the same issue. As the white cell will enlarge, and then on the right-hand side it's throwing off the histamine packets. This is what we really see in the ALCAT test, is that the cells will change size in response to a food. So initially they'll swell as they get ready to deliver its packets, and then of course after they've delivered the packets the cell shrinks in size. We see the RoboCat 2 is designed to pick up the size differences of the white cell population. So that's the basis of our test, is the size differences of the white cells. What are the conditions, the spectrum of conditions that we see help with? Involves this list that's on your screen that goes through from migraines to various GI disorders, all the way down to cardiac, diabetes, obesity, and behavioral medicine issues. So the list includes almost any condition that's sort of talked about as autoimmune or inflammatory disease. These will all be helped. I get calls all the time about sort of rarer conditions, and we're gaining a good history of success with some of the various disorders. So as you have clients that come up with conditions, give me a call and we can discuss it. So as we talked about before, the ALCAT is a live cell test. We isolate the white cells from whole blood. That gets rid of the platelets, the red cells, and some of the other factors. We throw in some plasma to the white cell fraction, and that's what's incubated with food mashes. We will take on each, we fill a 55-well cassette with 50 antigens and 5 control cells. The 5 control wells are just the white cells, and they give us our baseline control curve. And then that control curve is compared to the curve with the different food mashes. And we'll talk a little bit about the some examples. Sort of talked about this, so I'm going to move on. So here's on the lower left-hand side is a distribution of the cells. The area number 1 are our lymphocytes. Area 2 is our eos and basophils, which of course are a very small percentage of the population except in EE patients. And that's one of the rare conditions that we've had a lot of success with. Area 3 are our granulocytes, so that's the neutrophils and the monocytes. And that's the majority of our assay concerns the granulocytes, because of course those are the ones that will will degranulate. The curve on the left is a non-reactive test, meaning that in this case artichoke was tested, and the curve for the artichoke lies almost directly on top of the control curve, and that would be a negative or a non-reactive test, or a food that that individual is safe to eat. On the right-hand side is mint, and in this case mint is causing a shift, a right shift against the control curve, which shows a degranulation test, and in this case there's enough evidence to say that it's a 2+, or that's correlated for the results as a moderate reaction. And we're basing our results on standard deviation differences away from the control curve. So a 2+ is 2 standard deviations from the control curve. In the next example of cayenne pepper, the reaction is so strong that it's labeled as MPOS, or that is one of our severe reactions. So that's the most reactive that we see, and you can see the shift to the right, and then on the tail end of the granulocytes, it's much farther to the right. On the right-hand graph, you see the opposite. You'll see the curve for BAS is shifted to the left, and then underneath the control curve on the downward slope. That's a 2+ reaction. So we have different types of physical reactions, but they are all put into the terms of either a mild, a moderate, or a severe reaction, or non-reactive. So who are the candidates? Individuals that are suffering multiple clinical scores, athletes looking to improve their performance. I can't give details, but we have a number of college and pro teams that do testing with the ALCAT to optimize their physical prowess on the athletic field. There are very few individuals that I've found that really can't use some optimizing. I'll get calls from different practitioners who say that I'm in really good health and I really don't need to do the ALCAT, but I'll do it just so I can see how it's going to work for my patients. And if they're compliant, they'll call me back a couple months later and they'll say, wow, I have so much more energy than I used to, and I'm able to now work the hours that I was working 10 years ago. Now, that may not be a good thing, but at least they're able to work the long hours again. Obesity, the inability to lose weight, is a hallmark of inflammatory disease. Abdominal stem cells, or the abdomen collects stem cells. It's very difficult to lose weight in older Americans. Being compliant with the ALCAT is critical. They can, by eliminating foods that are sort of drawing their stem cells to the gut, they can begin to lose weight without really having to change their exercise pattern, although exercise is always helpful. But obesity is a big reason a lot of people do the ALCAT, and it's been shown to be very effective in a number of trials. There are a number of studies that are found on our website, and there's a section on the website for clinical studies. We're in the process of doing a number of studies here at the company, and I'm going to go over them briefly, quickly. We have a big study that's being done with the University of South Florida for reliability and split sample testing, which has come under some scrutiny over the past year. So what the university is doing is recruiting a number of individuals. They're coding them to their own satisfaction, and then bringing the samples to our lab for analysis. They'll be analyzed in our lab, but as soon as the results are available, they're going to be stripped off, taken back by the university for analysis. And that's going to be published whether we like it or not, as they say. That's one study. We're doing a number of studies with a GI group out in the West Coast. We're doing some dermatology studies in New York with severe acne, and a weight loss trial also done in the state of Florida. So we're doing a number of clinical studies over the next year to boost up our sort of medical credibility. We're also, I'm involved in the R&D department. We're also looking at several new tests and expanding our current knowledge base with new foods. We're looking at a Spanish panel for our partners that are in the Caribbean and South and Central America, and adding some foods that we get complaints that aren't on our 200 foods, like black beans. Catherine, what else is in that list? I can't even remember, but there's a number of, I think, 12 foods that we're substituting into our 200 panel at this point. As I mentioned earlier, the triad is doing the ALCAT, treating for leaky gut, doing the detox. Because in the mode of patients doing the ALCAT, what will happen is that a number of heavy metals and pesticide-like compounds that have been sequestered in fat will come out of the system as the biochemistry changes. So some weeks into the program, it's important to supplement the liver in its ability to, in the phase 1 and phase 2 detox pathways, and that can be supplemented with herbs such as milk thistle, burdock, dandelion, green tea, which improves the ability for the liver to methylate and sulfonate various toxins so that they can be passed out through the urine. So that's that and good daily exercise. And I'm not talking about getting people to the gym. I'm just asking them to be taking daily walks and just having some regular body movement so that that increases the efficiency of the whole program. So that's the sort of the fundamental program. We at the ALCAT have both a meal plan that we add, and I'll have Eliana talk about that, but that was designed for individuals that don't cook or didn't know how to cook and are stuck with the whole idea of how to go about using the ALCAT test. So we prepare a series of menus and daily sort of approaches to how to eat this, how to eat their foods. And then we layer in a compliance program, because the key to the whole ALCAT thing is compliance. If your patient is very compliant, they will succeed. If they're not compliant, it all goes really down the tubes. We check in the compliance program a clinical score. So we'll take a clinical score at the outset and then watch it every month as they go through the 6-month program. Our typical score, or average, starts with about 100 points, and they get anywhere between 0, 1, 2, or 3 points for a number of different clinical symptoms. And so our typical average starts at 100, and by about week 10 to 12, they're down to about 15 points. So the dramatic decrease in inflammatory disease or symptoms has been observed on hundreds of cases. So that would be the typical response. Now, I'm not going to say that everybody responds that way, but a good about 80% of our patients respond with that type of approach. Whether the other 20% are just not compliant, or it's we didn't catch the right foods, or something else is going on, I don't know. But having an 80% success rate to me is great.
So what are the benefits of adding ALCAT to your practice? Overall, you can expect to see improved patient wellness. In addition to that, one moment here. In addition to that, the ALCAT test can be a fantastic tool to add additional revenue if you so choose. We have multiple ways we can set up your billing. If you choose to not be involved, your patients can deal directly with the lab as far as payment, and we can arrange that in different ways. An additional thought on that is insurance, which I will touch on in just a moment. As I discussed previously, we have 320 plus test agents available currently, including all the different foods, additives, the chemicals, molds, and the medicinal herbs. The patient test results are available online, which make it very convenient for you in a PDF format. A lot of practices are converting to electronic medical records, so this is a very simple way to incorporate that into those programs as well, seeing as how you won't have to be scanning in your patient results and such. The hard copy, which includes all those color-coded test results and the 50-page color booklet with all the information, is at your office within 10 business days. And the customized rotation meal plan is provided with each set of test results of at least 100 foods. Anything less than 100 foods, our software is not able to create that. There's also a wallet-sized result card included with each result, which is a great tool that your patients can tuck into their wallet or their purse and use this when they're out and about throughout the day or when they're doing their grocery shopping. It's been a really great tool. We've gotten fantastic feedback from both practitioners and patients regarding this. Also, we have a team of nutritionists that are on staff to provide support to your office. This can be done in multiple ways, whether you have questions regarding test results or the testing process or pretty much anything. They are available, and also with your authorization, this team is available to your patients for additional questions as well. We do have an insurance pre-verification department, which has a 24 to 48-hour turnaround. It's a really great service to use. There's a form available for this. You can either get it from your account manager or the customer service department. It should be in your introductory professional folder, but if you do need it, just let us know and we'll get it over to you. This gets faxed into our insurance verification department and returned. We check in and out of network, and we really are very thorough with this to get the best idea of coverage, whether we are filing on behalf of the patient, whether your office is filing, and we do really try to assist you through that whole process depending how you choose to set it up. For a lot of our practitioners that don't draw blood in their office, we have a mobile blood draw option, as well as multiple walk-ins depending what area of the country you're in. But this mobile blood draw is very convenient, and they can go right to the patient's home or to their work, and it's for a pretty nominal fee. I believe it's $45. And just as a added note on that, that blood draw option is available at no cost for any patient doing the Platinum Comprehensive Test. We do cover the cost of the draws for that panel. And additionally, we have a nationwide patient referral service. We do quite a bit of advertising and patient education throughout the country and through different methods, both in print, through television occasionally, through different news sources. And a lot of patients do call in asking for further information. Our first way to handle that is to try and refer them to practitioners that are already offering the testing. That way patients can really get the best experience and the best results from the test. So becoming one of our providers adds you to this referral service and can potentially bring new patients into your practice. So an additional option that we have is a nutritional compliance program. Do you want to just briefly discuss what that is? This is Catherine Holmes. She's our senior nutritionist, and she'll just briefly discuss what this program entails.
Yes, this is fairly new. We've been doing it for about 5 or 6 months and have had real positive reviews on it. And the patient or the physician, healthcare provider can sign the patient up. And it really helps them be compliant because we as the nutritionist first go over the results completely so they fully understand them, talking about elimination, rotation, and of course substitutions for food that they need to look for. For instance, if they're gluten or gliadin positive or dairy, and so we give them substitutions for that. And then we follow them. We, as Dr. Blum has said, we have some forms that we fill out along with brief health symptoms, and we follow them throughout the 6 months to see how they improve. And then we do monthly talks with the patients to keep them motivated. They also have our emails so that they can contact us at any time. And it works really well. It helps keep your patients focused, and you can be assured that they will have the best results because it helps to motivate them. as they go along. Some of them are pretty overwhelmed when they first start, and before they know it, they're doing really well and feeling good about it, and of course feeling so much better because it helps so much with wellness.
And briefly, the cost of this compliance program, this is another one of the tools that you can use to add revenue. We do offer professional pricing on this of $199, and our list price for this 6-month program is $299. So that's something you could offer to your patients and collect on your end and have that $100 of revenue for your practice while we are offering the service to your patients. Now, as far as the actual testing process, it's very, very simple. Most of you should have at some point seen an ALCAT Test kit. It's a small cardboard box, and the contents of that include 4 blue top vials, as well as a biohazard bag. I believe the most recent test kits have a styrofoam encasing for the blue tops. There is a requisition form included inside each kit. Our kits are generic, which makes it very easy for your practice, so you don't have to stock 10 different types of kits. It's just one kit, and when you're ready to use it, you select the panel that is being run. Inside that kit, you'll also find a prepaid FedEx clinical pack. This has a billable stamp on it with all of our information. All you have to do is put the sample in, seal it, call FedEx for pickup, and they scan that to our account upon pickup. There's also a slip in the kit which covers the collection and shipping instructions. Just discusses the brief drawing instructions. Being a whole blood test, there is not much to that, but the shipping does need to be sent out that same day. Our regular kits are for blood draws that occur Monday through Thursday. And we now are offering Friday kits. These kits are the same. The only difference is the clinical pack inside the kit has a different label. We had to do this so that FedEx would be able to deliver to us on Saturday, but that is the difference. So if you do not currently have any of these at your office and you need some, just let customer service, your account manager know, and we will gladly send some out for you. So with the kit, you fill out the requisition form, the vials are placed into the box provided. You want to make sure to place everything inside that box before you put it into the clinical pack. Otherwise, we've had experiences where the vials are in the bag loose, and unfortunately they do get damaged in transit, which makes us unable to run the testing. The FedEx pickup can be arranged by calling 1-800-GO-FedEx. You can just simply ask for a representative. You don't need to wait for all the prompts. And then just let them know you have a billable stamp express pickup. Do check in your local areas what the express cutoff time is. If you are unable to, just let your account manager know or customer service know. We will definitely find out for you to ensure that these draws get here on time for us. Usually FedEx requires about a 2-hour window from that express cutoff to be able to pick them up that same day. That is in most areas. In more rural areas, some require actually a call the previous day, so you may have to schedule those draws a little differently. The sample doesn't require any spinning or refrigeration, being whole blood. During the hot summer months, what you may receive are ice packs. And this is just done to keep the sample from overheating while it's in transit, since those FedEx trucks can definitely get a little bit hot. And the drug interactions, I will have, can you cover those? Okay, Catherine's going to cover the specifics on this.
Yeah, we have a few drugs that we would prefer the patient not to be using at the time that their blood is drawn. The most important really is antihistamines, and they should be minimally off for 3 days. Steroid nasal sprays, 12 to 24 hours, the most 48. According to what kind of steroids they're taking, we have done patients on 10 milligrams of prednisone if that's a baseline for them, meaning that they are on it constantly. But if a patient is on perhaps a Depo-Medrol dose pack where they have a high hit of steroid and then within 7 days they're coming down, it's best to wait and wait approximately 10 days after they're off of that. Our vitamin C, we've just changed that to 3,000 milligrams. So if a patient is taking anything under that, they can certainly do the test. Anticoagulants, warfarin, heparin, Coumadin, we have done 6 and 7 milligrams, and the test is run fine. Usually with anticoagulants, the patient cannot come off of them. Antibiotics do not affect the test, but the bacterial infection does. We really prefer them to be wherever their normal immune system is. So if they have chronic inflammation, that's fine, but if they have a spike and they have a bacterial infection, it's best for them to wait until that's over.
Well, this, pardon me, this is the conclusion of our presentation. Michelle is coming back here as our moderator. Let's see, do we have any questions?